Good afternoon. So the SUSTAIN clinical trial program was developed to analyze the safety and efficacy of once-weekly subcutaneous semaglutide. And across this clinical trial program, there was a consistent reduction in hemoglobin A1C, weight, and systolic blood pressure across all of the comparators and placebo. And therefore, this study was a post hoc analysis of these clinical trials to examine a clinically relevant composite outcome of cut points that are deemed to be clinically significant for reducing cardiovascular risk. So the statistical analysis was a composite endpoint analyzed with a logistic regression model. Table 1 shows the baseline characteristics of the clinical trials and demographics. And so I'll just quickly run through this. SUSTAIN 1 was monotherapy versus placebo. SUSTAIN 2 through 4 were add-on to oral agents, and 2 was sitagliptin, 3 was exenatide once weekly, and 4 was glargine. SUSTAIN 5 was versus placebo on a background of basal insulin, glargine. And SUSTAIN 7 was versus dulaglutide at both doses individually compared. The figure 1 shows the key result. So the light blue is the 0.5 milligram semaglutide dose, and the dark blue is the 1 milligram dose. And the comparators are in the other colors here. So in SUSTAIN 1, 15 to 16% of the patients reached this composite endpoint, which again was a hemoglobin A1C reduction of greater than or equal to 1%, systolic blood pressure reduction of greater than or equal to 5 millimeters of mercury, and weight loss of 5%. In SUSTAIN 2 versus sitagliptin, we have anywhere from 20 to 30% with the semaglutide and 4% with sitagliptin. SUSTAIN 3 versus exenatide is 22 versus 6%. SUSTAIN 4 versus glargine, 14 to 21 versus 1%. And impressively compared to placebo on a background of basal insulin, up to 37%. Then finally, SUSTAIN 7 is 19 to 33% versus the respective doses, low and high, for dulaglutide of 7 to 12%. In figure 2 is the time to composite endpoint achievement. And we can see that consistently the endpoint was achieved consistently faster with both doses of semaglutide versus the comparators. In particular, versus the other GLP-1s, the time point of separation is about 12 weeks versus placebo and glargine about 8 weeks. So in conclusion, a higher proportion of patients reach this composite endpoint, and this might explain some of the outcomes observed in the SUSTAIN 6 trial, in addition to any potential direct effects. Thank you.